My name's Dr. Robert Norton. I'm an orthopedic spine surgeon. I practice at Florida Spine Associates. I attended Rutgers University undergraduate, where I graduated with a degree in Bachelor of Science and with high honors. And then I went on to do medical school at Jefferson Medical College in Philadelphia. When I was there, I graduated with honors as well, magna cum laude distinction, as well as junior AOA distinction, which is only offered to the top 5% of medical students. After medical school, I traveled down to Florida at University of Miami, Jackson Memorial Hospital to do my residency program in orthopedic surgery. While I was there, I served as the administrative chief resident and published an extensive amount of literature. And then I went on to complete a spine surgery specific sub-fellowship at NYU Hospital for Joint Diseases, where I spent a year dedicated to mastering my skills in spine surgery. I decided to go into orthopedics really at a young age. I played a lot of sports, predominantly football growing up. And of course, like everybody that plays sports has had their fair share of injuries. And I saw how the recovery process was working with some of the orthopedic surgeons locally. They allowed me to shadow them after I was treating with them, and I got to see firsthand what they were doing. I always knew I wanted to go into orthopedics, but I wasn't exactly sure what subspecialty I wanted to go into. I determined that early on after I got connected with some of the most famous spine surgeons in the world to do research with them, and again started following them in a mentorship style and just fell in love with it. So I like to joke now, my part-time job is practicing as a orthopedic spine surgeon. My full-time job is really coaching baseball. I have 3 boys. They all play rec baseball and travel baseball, and I literally bring my gym clothes with me to work, and then I change in the afternoon, and today I'll be on 3 different baseball fields and get home by 10 p.m. Orthopedic spine surgery is a unique field of orthopedic surgery because it's probably the only subspecialty of orthopedic surgery where you can both work with large instruments like hammers and tools and do heavy labor type of work. It's almost like we have a garage in the operating room, and then simultaneously work under a microscope with fine motor control and do very detailed work working around the spinal cord. And I would say ultimately that my biggest passion and reason for performing orthopedic spine surgery and the thing that gets me to keep going every day and keep working hard are my patients. It's so nice to come in and have patients hug you on a daily basis and thank you for changing their lives, and it's really impactful for what we can do to the community.